Dear audience, if you think back, the first COVID-19 diagnosis in Hungary was almost 2 years ago, on March 4, 2020. As time goes by, our knowledge of COVID-19 grows. We aim to join to the united scientific effort to reduce the impact of COVID-19 with a translational approach. I'm working in the National Pediatric Institute, and at the COVID outpatient clinic, I have weekly experience with the children affected by the disease. My irreplaceable, huge help in my work is my supervisor, Andrea Parnitsky. My vision is a world which has established ground rules in fighting the pandemic. There are 3 perspectives that we consider remarkably important. Firstly, we examine the prevalence of asymptomatic infections for understanding viral transmission patterns. Secondly, we investigate the effectiveness and safety of TNF-alpha inhibitors as a therapeutic option. And lastly, we could have a deeper understanding of COVID-19 by conducting an analysis of our cohort. Let's talk about my first project. We investigate the prevalence of asymptomatic COVID-19 in different pediatric age groups. The symptoms of COVID-19 are similar in children and adults, but the frequency of the symptoms varies. Children are likely to have a higher proportion of asymptomatic infection than adults. Therefore, they have a key role in the transmission. Our aim is to investigate the prevalence of asymptomatic COVID-19 in different pediatric age groups. We examine PCR-confirmed SARS-CoV-2 infection in children because our hypothesis is that the prevalence of asymptomatic COVID-19 is higher in school age, 6 to 12 years of age children, than other pediatric age groups. We conducted the analysis in 3 databases, and we had more than 18,000 records before the duplicate removal. We also have an approved Prospero registration. And here you can see our first results. The population and exposure are children with PCR-confirmed SARS-CoV-2 infection. Yes, we have a huge amount of study. There are 241 eligible articles with 9 different PCR screening strategies included this analysis. So yes, there is a huge amount of study with big heterogeneity. As a result, we get 33% of asymptomatic infection in children, which support the suspicions of the big ratio of asymptomatic infections in children. Secondly, we examine the prevalence of asymptomatic COVID-19 in different pediatric age groups. We set up 4 age groups and also pooled in this analysis all the 9 screening strategies. So, as you can see, there is 27% and 23% until the age of 5, and the proportion of asymptomatic infection is the highest in the school age children. It's 39%. So it supports our hypothesis that it's confirmed that the highest proportion of asymptomatic infections in the school age group. As I mentioned earlier, we identified the 9 different PCR screening strategies during the data extraction process. Here you can see a brief overview of them. We will create subgroup analysis each of them. A few words about the strengths and limitations. We created the first meta-analysis about the asymptomatic infection in children, and the different screening protocols and the lack of the uniform data reporting were our main difficulties and limitations in this analysis. In summary, we can confirm the suspicion of high prevalence of asymptomatic infection in children, especially in school age group, and it is possible to create recommendations for targeted screening protocols, for example, in schools. Meanwhile, the regular forehead temperature measure could be unnecessary and ineffective. We can highlight the importance of vaccination in children as well, and in a case of diversified symptoms and complaints, the history of asymptomatic COVID-19 should be considered as well. And of course, there is a need for investigations more about the predisposing factors of COVID-19. Secondly, we investigate the effectiveness and safety of TNF-alpha inhibitors in COVID-19 therapy as a therapeutic option in severe COVID-19. The COVID-19 Global Rheumatology Alliance Registry collected information from clinicians of patients with rheumatic disease who were diagnosed with COVID-19. Being on a treatment with anti-TNF therapy was significantly associated lower odds of hospitalization related to COVID-19. Our aim is to investigate the usability, safety, and effectiveness of TNF-alpha inhibitors in COVID-19 therapy. We included studies that conducted the analysis in a population with SARS-CoV-2 infection, and we accepted a control group as a population with only have standard of care without any administration of TNF-alpha inhibitors. Our hypothesis is that the administration of TNF-alpha inhibitors associated with better clinical outcomes. And we would like to have an improvement in COVID-19 therapy. The systematic search was conducted in 3 databases, and we also have an approved Prospero registration. And lastly, I would like to talk a little about our descriptive registry analysis, characterization of COVID-19 in Hungarian children, analysis of 507 prospectively collected patients' data. As discussed earlier, there are a lot of gaps in our knowledge about COVID-19, especially in children. Our aim is to create a descriptive analysis based on our unique and uniform data collection, which I will present on the next slide. This is a figure about the registry structure. The involvement criteria are children with suspected or confirmed SARS-CoV-2 infection. And as COVID-19 is confirmed, data from the patient has been collected right away on every inpatient day. So this registry is capable of following the patients from the first emergency room visit through all steps of healthcare. For the data collection, we use an admission form, an inpatient form, an ICU form, and a follow-up form with vaccination information. And biological samples collected constantly throughout the process. And now let me lead your attention to the main conclusion. We identify 9 different steps to help the patients with COVID-19. Firstly, we investigate the prevalence of asymptomatic COVID-19 in different age groups. Secondly, we investigate the effectiveness and safety of TNF-alpha inhibitors as a new therapeutic option. And lastly, we could have a deeper understanding of COVID-19 with the registry analysis. Thank you for your attention. I chose a quote from Muhammad Ali: "Don't count the days, make the days count."
You are trying to observe the severity of the COVID, if I'm right, by patients who are taking or getting the TNF-alpha inhibitors. Am I right? It was okay. So I'm working in a hospital where we are treating patients with biological therapy, IBD patients especially. And we went through during these 2 years, and we've seen with the patients' habit also how changed, and also first we changed the therapy as well, and then also the virus is also, already changed. So if you find some articles from 2 years ago, it will definitely be different, just like today's, I think so, because in the very beginning everybody have a big fear from the virus infections, and especially patients who are taking anti-TNF-alphas, because they knew that they have a bigger, so by the time we thought that they have a bigger risk for severe disease. So they were wearing masks and so on. They were really strict rules, and in that case, that's why we didn't see any difference at the very beginning. And right now, we didn't see any difference because everybody went through the COVID. I mean, all those patients as well. And also there's a question about the additional therapies. I mean, in rheumatoid arthritis, they also use methotrexate or some other immune modality therapies. Are you also considering to think about this one as well or not?
Yes, we investigate the TNF-alpha inhibitors in patients who didn't get before that. So they get the TNF-alpha inhibitors for severe COVID-19. So yes, of course, it has really big side effect lists and so on. So for critically ill and severe patients, we examine this therapeutic option.
Are you planning to do any other subgroup analyses rather than the screening strategies? Like I'm thinking about race or gender or so. Do you?
Yes, we collected data about the countries, so we can create subgroup analysis about the screening strategies in countries, or we separated genders separated children with genders into asymptomatic and symptomatic infection, so it could be interesting as well. So yes, we will discuss it. We have some idea for subgroup analysis.
Okay, thank you. And the second question would be about your third project. I'm dealing with long COVID in the pediatric population, and I'm interested in that whether you will have an analysis on the lingering, so prolonged symptoms of those who got into the hospital, because what we see is that it's really not dependent on the severity of the acute infection. So what do you think about this?
Yes, we have data from the patients who were in HEIMPAL, National Pediatric Institute, and also we collect data from the controls when they come back and we examine them. So I think with this big data, we will create analysis from.
I would like to ask you, shown that in the school age there is a much higher prevalence. Do you have any idea why do you see that the asymptomatic is more prevalent in that group?
Yes, maybe they have higher exposure than other groups, but we can also see that neonates has also a higher prevalence than 1 to 5 years of age children. So we have to think about it and try to explain.
Thank you.
Thank you very much. Just short comment. We have an excellent network and national network and registry for cystic fibrosis, pediatric solid tumors. It should be nice for pediatric COVID patients too. I wish for a 6th wave instead of a war.